The police officers led by Andrew Akanyijuka, the officer in charge at Kabale Central Police Station, swung into action and ordered the protesting pre-intern doctors to surrender all their placards and leave the area.
So who are organizers? Who are the leaders?
Yeah, some people.
No, I want to see the people who are organizing.
We called them when you told us. We called them to come and talk to you.
Okay, what I want to do is stop this in good face. Isn't it? You bring the banner and see all of them. Say, you bring the banner. All of them, you bring them. You call it basically.
Kanyijuka later demanded to meet the leaders of the protesters, but none of them was willing to identify themselves as the leader. The angry protesters said that the Ministry of Health was poorly handling their grievances, which they had clearly stated on a number of occasions.
To pass a policy where they want to be paying us our allowances as they are supposed to pay us, because they are saying there's no money to pay us, but we need to be paid because we need to work. We are humans. We need to parent. We need to feed, and that is those allowances are the ones that facilitate us during our internship period. And intern doctors are a major, like almost the biggest percentage of the health workforce in Uganda.
Medical interns, people who graduate and finished medical school, nurses, doctors and pharmacists. We are against a policy that is being passed where we are not going to be given our allowances as people who have graduated and finished school. We have graduated, finished school, and we are always having our allowances. Apparently the government does not have money to cater for our allowances, yet they are going to be deploying us in places like Moroto where we shall be needing our allowances, our lunch to cater for our needs as we take care of our patients. So intern doctors are supposed to be earning 2.5 million, intern nurses are supposed to be earning 2.2 million, intern pharmacists are supposed to be earning 2.5 million. So that's the allowance that has always been there.
We are here to remind the government of the Presidential Directive of 2021 to pay interns half their salary and to deploy them. The country is bleeding. Muzeyi, let them respect your directive. Fetuli bazzukulu. We are not activists, we are only demanding for what you promised us.
The pre-intern doctors have also asked the government to pay them salaries instead of allowances, and that must be provided in the national budget, just like all other government employees. The new interns were supposed to be deployed to the over 30 internship sites by 1st April 2023, but according to the circular, the Director General of Health Services, Dr. Henry Mwebesa, sent to the directors of government hospitals, the one-year internship training will begin later. Dr. Mwebesa noted that there were still a number of issues to be sorted out before the training, adding that consultations were ongoing. One of the proposals by the Health Ministry is a change of policy to have all privately sponsored medical students to meet their internship costs instead of the government covering it, as has been the case because the costs have gone high and the government can no longer afford it.